and making this workshop run smoothly. So now we will move from the air pollution and health policy perspectives to our next session, in which we're going to delve into the air pollution sources that drive health impacts. We have another excellent set of speakers in this session, and to introduce them, it's my pleasure to introduce the chairs of this session. Dr. Mira Dasic is trained and worked as a specialist pediatrician for 2 decades before a series of high-profile positions within WHO and the government of Montenegro. She has extensive experience in the development of policies and regulations in numerous areas of public health. And since March 2017, she has served as the director of the Southeast Europe Health Network Secretariat with a seat in Skopje, North Macedonia. Our second chair today is Dr. Dzhambov. Dr. Dzhambov is a medically trained doctor with postgraduate qualifications in preventive medicine and mental health. And he currently works as a senior assistant professor of hygiene at the Medical University of Plovdiv in Bulgaria. And his research interests span environmental and occupational epidemiology with a focus on health effects of natural outdoor environments, environmental noise, and air pollution. And he received the ISEE Rebecca James Baker Award in 2017. So it is my pleasure to now hand the floor to you to lead the session. Dr. Dasic, please. Thank you.
Thank you. Dear organizers, speakers, colleagues, ladies and gentlemen, it is my honor to co-chair and moderate the session 3, Relevance of Various Air Pollution Sources in Driving Health Impacts, with Professor Angel Dzhambov from the Medical University of Plovdiv. It is of utmost importance to understand the relevance of different air pollution sources as impact on the health outcomes. This information is key in our aim to design tailored and most effective policies for the Southeastern Europe region. I would like to offer the screen now to our first speaker, Dr. Branislava Matić, MD, PhD, and hygiene and environmental health specialist, who comes from the Institute of Public Health of Serbia, where she heads the environmental health and school hygiene department, dealing with air pollution, industrially contaminated sites, and chemicals management. She also serves as the national focal point of the Ministry of Health in WHO and in the UN Economic Commission for Europe on air pollution, environment, and health. Dr. Matić, the screen is yours.
Can you hear me?
Yes, it's good. Go ahead.
Well, hello, everybody. I was looking at the presentation of our assistant to minister, so I will cut short one slide, as there is one map that is repeating itself. So just don't be surprised if I just go over it very fast. Next slide, please. As we have heard yesterday, I will just repeat shortly today. This is the map of our environmental hotspots of different sources, and actually energy sector with the lignite burning power plants and open pit mines, for lignite, waste ash landfills and oil refineries is the key issue of our air pollution. Also, we have a very extensive mining, milling, and smelting activities, actually mostly for copper and lead. And we have one steel plant, secondary steel plant. Also, one of our, environmental hotspots for the region is Bore Mining Milling Complex, which has now an expanding tendency with the emissions mostly of sulfur dioxide, arsenic, and cadmium. And as we have heard, household fossil fuel combustion is also our very serious issue of concern. Then there is traffic. We are now in the phase of building large and very fast roads, but actually our towns are very, overloaded with traffic, as we have narrow streets, and there is not just the fluency of traffic is not good, and that is more to infrastructure. Then we also have municipal waste dumping sites, and also as for the industrial sources, we have cement plants. Next slide, please. I will just go shortly through this. You see the sources of different pollutants in Serbia. As for the PM 2.5 in percentage, it is mostly, as we have heard, power plants and household combustion, also industry. For sulfur dioxide, it is acquiring electricity and heating, and also power plants, not so much, but industry. This percentage of sulfur dioxide in industry mostly comes from bore, where sulfur dioxide is one of the mostly present pollutants in air. Also for NOxes, we see that it is electricity and heating requirement and road traffic. The next, please. This is the map that I was talking about. I will not go through these numbers, but actually I just want to point out these substances that we are looking after, because it is not just numbering the substances, but which of them has public health concern for us in the public health institutes. Naturally, it is PM10 and PM 2.5, but in last years, we are looking much more at these organic pollutants, also specifically to benzopyrene, which is now being measured at more and more stations each year. Thank you. Next one. And this is something that is of concern to us in the public health sector. Actually, we are now in a phase where we are trying to build up the multi-sectoral approach and to help each other in doing some mutual projects and trying to combine sources of data. So health information system can acquire us data from the primary and secondary level of healthcare for some specific diagnoses, which are of our concern. Then also in within the National Institute of Public Health, we have very, to say, high quality data within these 3 national registers for cancer, acute coronary syndrome, and diabetes. And what I forgot to say, mortality data are acquired from the National Statistical Service. As for the air quality data, we are supported strongly by SEPA for the data from both state and network automatic measuring stations and the local network, but also there is one problem, the data that we do not get. Which are those data? Data which local self-governments contract with specific laboratories, private laboratories and facilities which simply do not send back the data. So if we know that there is a local community that didn't get a contract either with the ministry or either with the Institute of Public Health, for us, these data are lost. As for the indoor air quality, we do not have legally regulated issues. So actually the only data that we get is from some project activities. Next, please. This is actually introduction to the next slide, and just to explain that I have chosen Bor. It is because this is the pilot town where we have results for health impact assessment of environmental pollution. As you can see, arsenic is really a problem. This is annual mean value, and you can see that in some years it has been exceeded very much. And also when you see this annual mean value for sulfur dioxide, you say, well, 77 is nothing. But when you see the maximum value is going to 3,000, 3,500 micrograms per meter cubic, then you will see that it is really a problem. The next one, please. So this is the project that we have implemented in 2018 with large support of WHO, UNEP, SEEHN, and Istituto Superiore di Sanità. And actually, I won't go through the title, you can see it, but the key issue is that we really established a multi-sectoral cooperation in between Ministry of Environment Protection, Ministry of Health through the Institute of Public Health of Serbia. We did a very serious epidemiological study on the population of Bor and 4 neighboring municipalities, having a strong referent population of southeast of Serbia. We use the data from the National Cancer Register, where usually annually 35 cancer localities are, to say, analyzed. And as I said, the project was realized in 2018. Next, please. I will just read, I won't read the whole text, but the point is that actually there is a strong relation established in between both mortality and morbidity of some diseases, and especially of lung cancer and other cancers. Actually, all cancers are much more frequent in Bor when you compare it to the reference population, but actually lung cancer and bronchial cancer are dominant. And what is our public health worry is that it is present in both men and women, which means that it is not specific to miners, to people who go down, dig in the earth and mine, and are surrounded with PM particles, with heavy metals or whatsoever, but actually it counts for all the population, and which is the issue of our public health worry. Next slide, please. And naturally, when we sum all these data, and we now can say that we can do very much about this, knowing this new epidemiological approach, then we did the data until 2015. Simply the data for other years were not ready, but now our experts who acquired this methodology have already data for 2018 and 19, when we can go further into analysis of data for other industrially contaminated sites such as Pančevo, Smederevo, Kosjerić, Kostolac, Branislava and Lazarevac. And we would like to go and further and improve the monitoring data analysis, implementing RQ Plus software, and also we would like to go further with other epidemiological methods. And I didn't mention it in writing, but actually a small project is now in place by the municipalities organization, where we are trying to wrap up and to make a sketch of local public health plans concerning environment and health issues. So we are looking very much into this local perspective. And we would like also to look after these human biomonitoring issues, which are now in Serbia at this moment. It's a standstill, and we have to do something about it, especially about some specific pollutants such as arsenic, lead, and cadmium. And also our key stakeholders for further steps, besides Ministry of Health, is National Institute of Public Health with our 25 local institutes, and also with municipalities, and a specificity of this listed municipalities. And our wish is also to involve the civil sector in all these activities. Next slide, please. And this is just the role of National Institute of Public Health. We already have produced the roadmap for sound intersectoral management of contaminated sites. Then we produced also the roadmap for development and enhancing health sector to engage in chemicals management. And now we're in a way of strengthening of national capacities for assessment of chemical risk to guide risk reduction. Actually, this project has just been started today, and we will do it together with the colleagues from the Ministry of Environment Protection, from the toxicology department of the Faculty of Pharmacy, and the public health experts. And also, within these projects, we will try to prioritize chemicals that are present in the environment and map the health risks for the one or two which are really the biggest problem for us. Next one. And this is the last slide. Well, you hear me speaking about chemicals. Somebody can ask why chemicals, where these chemicals come from air pollution. So we know that specifically Serbia is by population, by demography, a very old population, and we really have to look after the pregnant women and our small children and newborns. So we do have to look at the air pollution as one of the sources of chemicals in Serbia. Next one is just the last one. Thank you for attention. I hope it wasn't too long.
Thank you very much, Dr. Matić, for sharing with us how different sources contribute to population exposure to key pollutants in Serbia in such a comprehensive way. Now I'm handing over the chairing to Professor Dzhambov.
Thank you, Dr. Dasic. So our next speaker is Dr. Dima Tsanova. She holds an MD degree and a PhD. She is a physician with specialties in social medicine and communal hygiene. She is currently assistant professor at the Faculty of Public Health, Medical University of Pleven. Her research interests include demographic approaches for assessment of public health, epidemiology of health, health needs and health systems, and she's involved in research in the fields of social medicine and public health. She is a member of the Bulgarian Medical Association, Union of Scientists in Bulgaria, UFA, ASFAR, Forum of Public Health for Southeastern Europe, and the International Hospital Federation. So Dima, you have the floor. Are you ready to share your slides? Excellent.
Just a second. Good afternoon to all organizers and participants who are online today. It's a great honor for me to participate in this wonderfully organized event. Thanks to the organizers for this opportunity. My presentation is on how do different sources contribute to population exposure to key air pollutants in Bulgaria. Several words as introduction. Air pollution is a global threat leading to large impacts on human health and ecosystems. Air pollution was the fourth leading risk factor for early death in 2019, surpassed only by high blood pressure, tobacco use, and poor diet. Heart diseases and stroke are the most common reasons for premature death attributable to air pollution, followed by lung diseases and lung cancer. When it comes to Europe, air quality remains poor in many areas. Despite reductions in emissions and ambient concentrations, Europe's air quality was improved over time, but at the same time, it continues to give cause for severe concern. The European Environment Agency estimates that more than 400,000 premature deaths occur each year in the European Union due to air pollution and poor air quality. The three pollutants considered the most harmful by WHO and for which the evidence of health effects is strongest. Particulate matter with a diameter below 2.5 micrometers, nitrogen dioxide, ground level ozone. Air pollution is a complex mix of several pollutants, so the effects attributed to one pollutant may be partly caused by some others. Health experts consider the pollutants identified above to be proxies for the whole mixture. PM has been shown to be a robust indicator of the risk associated with exposure to PM from diverse sources and in different environments. Air pollutants may be categorized as primary and secondary. Primary pollutants are directly emitted to the atmosphere, whereas secondary pollutants are formed in the atmosphere from precursor pollutants through chemical reactions and microphysical processes. Air pollutants may have natural, anthropogenetic, or mixed origin, depending on their sources or the sources of their precursors. Key primary pollutants are listed here. I won't pass through them. Main secondary air pollutants are particulate matter formed in the atmosphere, ozone, and nitrogen dioxide. Main types of air pollution sources are mobile sources such as cars, buses, planes, trucks, and trains. Stationary sources like power plants, industrial facilities and factories, area sources like agricultural sources, cities and wood burning fireplaces, natural sources like wind-blown dust, wildfires and volcanoes. Now let's take a look at Bulgaria. Bulgaria has a history of Soviet-era industrialization with scant attention paid to environmental issues. Given its standing as one of Europe's poorer nations, it appears to have made limited progress in cleaning up our air. In 2011 report from the United Nations found that Bulgaria, along with Armenia and Romania, lead the world in deaths from outdoor air pollution. That said, the particulate levels reported in Bulgaria fall well short of the alarming levels. For Bulgaria, air quality was one of the priorities for our European Union presidency. The country's top priority is to reduce air pollution from low-quality domestic heating. Over half of all Bulgarian households use solid fuels, coal, briquettes, and wood to heat their homes. In cities like Sofia, this is the main cause of particulate matter. On this graph, we can see the proportion of the Bulgarian population using solid fuels. We can see that there is decreasing of this proportion, but still it is around 5 times higher in comparison with the European Union. On this slide, we can see top 10 leading risk factors for the total number of disability adjusted life years in Bulgaria, and the comparison between 2019 and 2009. We can see that among these risk factors, 10 risk factors, we have 2 environmental risk factors, air pollution and non-optimal temperature. Air pollution dropped down with 1 position and now it's on 8th position, but still among these 10 leading risk factors. Data are provided by Global Burden of Disease Studies. This table presents the number of years of life lost attributable to particulate matter 2.5, nitrogen dioxide, and ozone in Bulgaria in comparison with the European Union. What can be seen here, the values for Bulgaria are much higher than those for European Union. Only Serbia and Kosovo have higher numbers. This table was shown several minutes ago, but we can see the proportion of Bulgarian population exposed to concentration above European standards. There is improvement, but if we take a look at benzopyrene and particulate matter, still a lot of people are living in such areas. Now let's start with the different pollutants. First slide is for ammonia. We can see that the biggest share is for agriculture. So the main source for such pollution in Bulgaria is agriculture, mainly crops and livestock. Second pollutant is non-methane violent organic compounds. The main source for Bulgaria is manufacturing and extractive industry, mainly light industry. For nitrogen oxides, the main source is transport, especially road transport. In the graph, we can see decreasing as a positive factor here. About particulate matter 2.5, the main source for Bulgaria is residential, commercial, and institutional source for such pollution. The last pollutant that I have included in my presentation is sulfur dioxide. The main source here is energy supply, especially energy production. but manufacturing and extractive industry, they have a big role here, especially heavy industry and chemicals. For sulfur dioxide, we can say that in the graph we can see significant decreasing, especially if we compare 2011 with 2018. On this slide, I try to present a general picture for air quality in Bulgaria. With the red line is the threshold, with the green line, gray line is the annual average concentration in Bulgaria. Special attention we should pay on benzopyrene. Still, we are above the threshold, especially on traffic stations. And several words for conclusions. Agriculture must not be neglected in the battle for clean air. Energy and transport are the biggest cause of poor air quality in cities, but the agricultural sector is also an important source of particulate matter, as ammonia contributes to the formation of secondary particulates. Holistic solutions involving technological developments, structural changes, and behavioral changes are also needed, together with an integrated multidisciplinary approach. Efforts to achieve most of the sustainable development goals are linked directly or indirectly to mitigating air emissions and changes in atmospheric composition. Household air pollution is most closely linked to socio-economic and demographic development. Improvements in socio-demographic indicators, coupled with major investments in clean air energy for cooking, have driven significant declines in exposure to global household air pollution and its associated burden of disease. Reducing the burden of disease from air pollution is an important goal for Bulgaria to achieve. Communications of these patterns and trends forces recognition of the magnitude of the problem and whether or not we are making progress toward cleaner air and healthier communities. Here are some references that I used in my presentation. Thank you very much for your attention.
We thank you for the overview of major contributors to air pollution in the country. So I will now hand over to Mira to introduce our next speaker.
Thank you, Angel. Now I would like to invite Dr. Hanna Boogaard, who has more than 15 years of experience in air pollution epidemiology. She is a consultant principal scientist at the Health Effects Institute in Boston, the US, and currently based in Europe. She has been advisor of the World Health Organization, National Institute of Environmental Health Sciences, Health Canada, and other national and international bodies. She is associate editor for the scientific journal Environment International and co-chair of the International Society for Environmental Epidemiology Europe chapter. Dr. Boogaard, the screen is yours.
Thank you so much, Mira. Do you hear me okay?
Yes.
Yes, excellent.
Super. Okay. Well, I'm just so happy to be here. Thanks for your kind introduction. Before we jump into intervention studies, I would like to emphasize two things, and we've heard this before. The burden of disease due to air pollution is large. It's large across the globe. It's large in Europe, and it's also large in this region of the world. Secondly, there's this overwhelming body of evidence these days that has accumulated over the last 2 decades, demonstrating that health effects of air pollution are serious and that they can basically affect nearly all organ systems of the human body. So why do we want to assess the health effects of air quality actions, since there is already ample evidence relating air pollution to health? Well, there are many reasons for this kind of research. Air quality has improved substantially in many locations, and definitely further improvements are becoming more costly. It's also good to check whether the projected calculations of the benefits have actually happened. You know, all the burden calculations, and we have heard today, and we will hear about them next session. They are based on modeling approaches, and of course there are a lot of assumptions involved. There is also a scientific reason to pursue intervention studies. They may provide strong evidence for causal effects. It's basically the closest we can get to controlled experimental studies, which is considered as the gold standard. So how do we know that air quality regulations in action work? We test that using empirical studies. It's called accountability studies. Let's call it here just intervention studies. And really, HCI has a long track record of doing this kind of research and comprehensive reviews in this area. It started in 2003, where we published a conceptual framework how to go about this kind of research, a conceptual framework called the accountability chain. And I'm not going into the details here, but the idea is that there is an air quality action that leads to reductions in emissions, improvements in ambient air quality, reductions in exposure, and finally in improvements in health outcomes. Now, of course, there are often multiple actions and regulations taken at the same time at different levels, and there are all those feedback loops in all those steps of the chain. And of course, air quality actions are embedded and are part of the wider health and environmental and economic context. So just to give you a short overview of the kind of studies that we have funded so far, some may be familiar to you, including the coal bans in Irish cities. I will talk about this intervention in a minute. And just by the way, all our studies and all our reports are available at our website for everybody to use. And just to mention that there are several recent reviews on intervention studies. We recently published also a Cochrane systematic review in this research area. There are other high quality reviews. Please drop me a note if you cannot access them. I'm happy to provide them to you. Let me give you a few key observations looking at the body of evidence so far. Most of the studies, most of the intervention studies we have, they have focused on sort of effects of relatively short-term local scale actions. Also sometimes interventions that are only temporarily in place. And really only a few recent intervention studies that have looked at large-scale, multi-year regulatory programs, of course, because they are so hard to do, and I will come back to that. Most intervention studies come from Western Europe and North America. This is not new. This, you know, we've heard this, in the last 2 days, that there is really a lack of studies in this region, also a lack of intervention studies. And I just quickly looked up in PubMed, some intervention studies in this region. I found only 2. I'm sure I've missed a few. There was one study in Romania looking at a factory closure. And there was this other study in Slovenia where they looked at the effects of a street closure only on air quality, no health involved in that study. But really, there's this lack of studies, right? And by the way, those 2 studies, they report improvements, but also highlight some challenges. Going back to the body of evidence, of this research area. There is this wide range of interventions on different levels. There are these different contexts, a lot of health outcomes, different study methods, really making any overall conclusion difficult. I guess it's safe to say that intervention research provides weak evidence that air quality and health improvements over the last few decades can be assigned to air quality. But, and this is a very important but, really it doesn't mean that policies and actions haven't helped. It really reflects methodologic difficulties in linking regulations and specific policies causally to the effects. And without going into a lot of technical issues here, I would like to point out a few key challenges. There's this lack of data. No need to dwell on this here. I've touched on this. For sure, this is a huge issue. And there's the complexity of the system. Often there are multiple interventions implemented around the same time at multiple levels, and there's this host of other factors that are affecting air quality and health that you of course need to take into account. And there are those methodologic challenges. Often those intervention studies are pretty small. So they often lack sort of the statistical power to demonstrate anything. Sometimes those studies don't include control populations, and this is really a crucial issue, or they have included the not the appropriate one. And there are questions about how to account best for underlying time trends, especially in long-term studies. This is an issue. And I'm going for a minute or so talk about really a key element of intervention studies, which is making sure you have a control group that was not affected by the action. So this is a famous intervention study. It was published in the Lancet quite some time ago about the coal ban in Dublin. Really a success story. There were immediate reductions in ambient air quality and improvements in basically reductions in mortality, both in respiratory mortality, cardiovascular mortality, as well as total mortality. So the same investigators, they have done an extended analysis, but this was actually funded by HEI, where they did a couple of additional things. They extended the analysis to other cities in Ireland, where they had also coal bans implemented in a later time period. They doubled the study periods. And also very important is that they added a comparison populations. Basically, this is an additional check whether you can attribute the improvements in health that you can see, whether you can attribute it to the policy measure or to wider changes in a population. So this extended study, they confirmed that air pollution levels went down. This extended analysis also confirmed that there were indeed improvements or reductions in respiratory mortality due to the coal bans. But the other thing, and this is very important for cardiovascular mortality and total mortality. Basically, the investigators, they saw similar reductions in mortality in the comparison counties compared to the ban affected counties. Basically, it means that reductions that were seen in mortality could not be attributed to the ban, but to wider social changes like overall improvement of heart health. So really, this demonstrates that the importance of including control populations. I guess this is really the key issue in doing those intervention studies. Wrapping up here, so what do intervention studies add? They offer real-world opportunities. If well designed, they can offer significant insight on cause and effect. But you need to find the sweet spot where an action has caused significant change in air quality. Of course, you also need then to have this good data set to work with, and for sure more to be done. And looking in this region, I would like to encourage everybody to see if there are potential opportunities for this kind of research. There's a lot of things happening, a lot of intervention at different levels. I list here only a few options, and I'm very much looking forward to a discussion on those issues. Thank you so much. Back to the chairs.
Thank you very much, Dr. Boogaard. Thank you for presenting the comparative benefits of air pollution interventions. And as I have seen in the questions and answer, we do not have any specific questions. Is that correct, Angel?
Yeah,
okay.
I don't see any.
Okay, you can still ask the questions later on in the questions and answers or in the chat. So because we are a little bit late with the time.
May I as a chair ask one question that personally
yes,
interests
please,
me?
Go ahead, Angel.
Yeah, it's for Hanna. So how would you recommend disentangling effects of, I mean, in intervention that concerns traffic reduction, for instance, effects of air pollution and noise, considering that they have a common source? What's the usual practice in this regard?
Well, thank you, Angel, for this question. I mean, I guess the regular practice is that you either focus on the one or the other, right? So yeah. You know, we have traffic related air pollution people and we have traffic noise people. So no, that's not a good answer.
There is always a competition between both.
Yes, yeah. But yeah, I mean, this is really, you know, this is all part of how to do best those intervention studies. And of course, I can think about, you know, specific interventions targeting traffic noise. I can think about specific intervention targeting traffic related air pollution, and there are some experiments, you know, that you cancel sort of the noise out with headphones and all that. So I mean, they're very clever things to do, I guess, but it's a hard question. Thank you.
There is one request in the chat, if they could see the last slide once again. But I guess the presentations will be shared later on by the organizer. So
correct, yeah. And Pallavi just put in the content of that last slide, and just to clarify, these are only just a few options, right? There's many more, but I would like to thank everybody whether there's this opportunity for this research. And just by the way, we are organizing at ISEE this network event. This is a perfect opportunity to talk more about research in this area. So please feel free to join us.
Okay, then to conclude, I would like to highlight that air pollution is a major cause of premature death and disease, and is the single largest environmental health risk in Europe. Latest estimates by the European Environment Agency show that fine particulate matter, PM2.5, continues to cause the most substantial health impacts. It has also economic impact, shortening lives, increasing medical costs, and reducing productivity. Therefore, we need to join forces to accelerate equitable and sustainable interventions. Finally, I thank you for participation today in session number 3. I'm hopeful that our regional commitment combined with professional strategic guidance can maximize country-based health outcomes. So thank you very much for your attention, and this session is closed.